I know there have been a lot of questions people have had about our booster shots and the guidance. There was a lot of, honestly, some mixed messages from our federal partners over last week. As we've tracked along, we think a lot of it's become clearer. Obviously, the FDA met last Wednesday, and on Thursday, the CDC reviewed and came up with their recommendations. And finally, the director of the CDC issued the final authorization and direction. And this was exclusively for the Pfizer vaccine. That was the only vaccine that they were looking at data for. That same date on Friday, Maryland issued an authorization for booster shots to be given. It was completely consistent with the CDC guidance. And that same day, Montgomery County began giving booster shots. We looked at our numbers from Friday through yesterday, and the county has given 200 Pfizer shots that are third doses. So that includes both booster shots and those who are immunocompromised. Again, the immunocompromised, we've been doing those third shots now for several weeks. And then 23 Moderna third doses were given, and that's exclusively for immunocompromised because those boosters have not been authorized yet. So we've seen a modest uptick in folks coming out to, these are just the county-run sites. I'm sure if we looked at the community-wide, we'd see a much larger total there. Just for clarification for our folks who have been a little confused, I completely understand. It took us the better part of Friday to get clarification on who fell into which categories. We continue to give third doses to individuals with compromised immune systems, and that is anybody who received Pfizer or Moderna previously. It's not been authorized for the J&J vaccinated individuals yet. We're still waiting for updates on that. Within booster shots, if it has been at least 6 months after your second dose, you've completed 2 doses. Just for the Pfizer vaccinated individuals, the CDC recommendation, what we've implemented is you should receive it if you're 65 and older. You should receive it if you're 50 to 64 with a specific underlying medical condition. And you may also receive it if you're 18 and above with one of those medical conditions. That will be a decision that you make based on your own risk. And you may receive it if you're an individual with an increased occupational or institutional risk. To be direct, it really is the same medical conditions that were considered earlier for prioritization, and the same occupational and institutional settings that, again, were used earlier to give priority. So those, I know it's a long list here. We will absolutely link to them and include them on the website and at our site so that people can be clear on whether they fall into one of the categories. We're not asking for proof of being in either group at our sites. An individual just needs to attest that they're in one of those categories, and they'll be, as long as they're 6 months out and receive Pfizer, they'll be eligible for a Pfizer booster. We just want to emphasize to individuals that the CDC has made the recommendation that the COVID-19 vaccines are not interchangeable. So those who got Moderna and got Pfizer still need to wait for that authorization. We do believe that we'll get some updates within the next few weeks from the federal government.
If you find our videos useful to you, please like, share, and subscribe to our channel.